So, welcome everybody. This is a talk where I'm delighted to have invited Dr. Michael Cannell along to talk to you about the effects of sleep deprivation. Thank you for coming today, Michael. And would you like to just introduce yourself?
Yes, I'm now an independent holistic medical doctor, but I still work sometimes in the NHS as a GP locum. I used to be a full-time partner at Midway Surgery, St Albans, until I retired from them 5 years ago. I'm also very interested in other aspects, including nutritional and lifestyle issues of treatment.
So can I just ask you how you got interested in sleep?
Partly because I knew my sleep wasn't very good. I'll mention my journey briefly with obstructive sleep apnea, but I knew I wasn't sleeping very well. I felt ill, a bit overweight, generally not very well, not very fit. This was probably about 10 years ago, and therefore I had some other health issues. And along the way, I suddenly realized that having a good quality sleep is perhaps the most fundamental. I mean, we have to talk about, healthy diet, exercising, nutrition, but as I think Olive's mentioned, or that at least a third of our lives is spent in sleep, we need to understand why we need sleep. And to my appalling my medical training, I don't think sleep was mentioned at all. Maybe as a fledgling doctor, I went to one lecture on sleep, but that's about all. And I think very few GPs of my age had any concept of the importance of sleep, apart from knowing they needed it. And maybe the younger doctors had better training than I had.
And perhaps they weren't getting enough of it as well.
Yes. I think it's already been mentioned that reading this book, Matthew Walker made such an influence, and this was 2018, made avid notes, and it just was pure magic reading that book.
It's an exceptionally good book, and I covered it on Redbourne Recommends recently, and I too read it actually 2019, I think. And I was hooked by the first 2 or 3 pages because it just applied to me. Okay, so why do we think sleep is so important, Michael?
The analogy I like to say is that we all understand a little bit how computers work. We all understand, I think sometimes you have to switch them off completely so they have to open up again. We'll talk about rebooting. Basically, when you clean out all the rubbish from the computer, all those files that don't quite join up properly or in the wrong place, you've collected through the day a lot of garbage or irrelevant stuff, and then you've got important stuff. And so the whole purpose there's several purposes, but one purpose of the sleep is to absolutely do that, clean everything out, get rid of all the rubbish, sort things in the proper order, try to integrate new stuff with the old stuff. And that's just to do with memory, of course, but then there's all the other functions. It has to reset the body, it has to reset the clock, so you may not realize that you have a master clock, rhythms of the body, you have other clocks in other organs of the body, and it has to just synchronize everything together. And therefore, having a good quality sleep is fundamental. And I think Olive has already mentioned the cycles of sleep. It's not just the sleep duration, the length, but it's the quality as well as the quantity.
I think when I first found out about sleep, I was so surprised that there's so much was going on that I had no idea about. So you often say something about sleep being natural and not just an activity or a behavior. Would you like to tell us about that?
Yes, well, in my experience as a doctor, so often you had people coming in with sleep, not being able to sleep. That was it. And suddenly you thought, oh dear, this might be a long consultation, or I'm trying not to prescribe something. I want to try to talk about their lifestyle, and we'll talk about that, perhaps why it's so important, lifestyle too. But what was a revelation to me, again, Matthew Walker's book, describing the mechanisms of sleep. Our bodies are designed to sleep. So somehow, if you can let the body do its proper job, you will naturally sleep. It is a natural behavior. It's not something where you have to say, I can't sleep, I've got to sort this out, you know, and the more worked up you get, you're not going to sleep. Somehow you've got to unburden yourself so that the natural rhythm of sleep takes over.
Yeah, and it is just a relaxation, really. It's not a project, it's not a behavior. It's just moving yourself into a relaxed state.
Yes, yes. I mean, we'll talk about physical blocks and some psychological blocks and other things. There's many things that can interfere with the natural rhythm, but we have to get in tune with the natural rhythm.
Now, lots of us have got sleep issues. Lots of us have got sleep issues and we don't even really know it. But there is also some things about automatic triggers that get you to sleep. Would you like to talk about that?
Yes, well, I hadn't realized that daylight, getting the first bit of sunlight into our eyes or getting outside is so important in setting off the normal cycle, because when the light hits our retina, the back of the eye, it goes right in deep into the brain, the signal, something called the pituitary gland, and the daylight switches off the release of melatonin. Now, melatonin is something very important in this cycle and the body clock. It also has other help to do with the immune system, and it's an antioxidant and probably other things we don't know what it does. But daylight switches off the melatonin released from the brain. So it's like the sleep break has been, the break for sleep has been taken off. So suddenly we're in the awake cycle. And then in that process, another hormone from the brain is released called adenosine, and it slowly increases through the day. And as adenosine increases, and we've said melatonin is dropping, as adenosine increases, the pressure for sleep suddenly gets greater and greater. It's like you're turning on the tap. At some point, you reach a threshold when this adenosine says, sleep time, and you will fall asleep. And it usually happens after about 14 hours. For most people, the daylight cycle is, awake cycle is 14 hours, and the sleep cycle is 8 to 10. So it's 14 to 16, I should have said, or 8 to 10. So you will naturally fall asleep. But what you need to realize is certain things like caffeine inhibits adenosine. So those of us perhaps who tend to like caffeinated drinks, coffee, and also in tea, also in green tea, chocolate has a little bit, that will block adenosine. So it will mean that you stay awake longer. You might have difficulty in getting off to sleep. So that explains why it's a natural cycle.
It's a really complicated and a very natural cycle, isn't it?
Yes.
Absolutely fascinating when you start to learn about it. So can we talk a little bit about the physical and the bodily effects of sleep deficit? And to start with, what is sleep deficit? Because I'm sure a lot of people don't know.
Well, there's a difference between a sleep debt and sleep what we need for optimal health. So, you know, you can probably get by with 6 hours sleep, but are you going to be performing optimally? So there's a difference between the two. What we do know is that from scientific studies, after about absence of 3 nights of sleep, you start having mental health changes. This frightens me because as a young doctor, I would often have to be on call Friday, Saturday, Sunday, and I could often have either absent sleep or disturbed sleep for 72 hours. And yet I was meant to be helping, you know, very ill people.
Yeah.
Thankfully, some of those rotas have gone now. But, you know, studies have shown that even early signs of psychosis or paranoia, where you think somebody's out to get you, can start after about 3 nights loss of sleep. And apparently after 11 nights, they use it as a torture, sleep deprivation. After 11 nights of not being allowed to sleep, you're almost coming into area of where you might die. And that's how important sleep is.
And it's extraordinary. They used to, I read a story that there used to be in the Guinness Book of Records how long you could stay awake for, and they banned it because it was so dangerous.
Yeah, yes, that's so how else does it affect? Well, if we start with the bodily effects, impaired immunity. Now, these days of COVID-19 and pandemics,
Absolutely.
you know, it's so important. But also the whole body starts behaving abnormally. So the hormone systems of the body, thyroxine and insulin and cortisol and many hormones to the ovaries, estrogen, progesterone, they're all disrupted, and many other chemical systems, because they're all linked to this body clock, master clock system. And you also can put on weight. Apparently, obesity can be caused by as much as 5% due to sleep disorders. Obesity is linked to diabetes, blood pressure, heart disease. You have more inflammation. Inflammation is something which is generally bad for the body, low-grade inflammation. The blood vessels get inflamed. You might have more likely to have a blood clot and other conditions. And things like the brain. I mean, the brain is more likely to deteriorate faster. We call that cognitive decline. And then even, I'm afraid to say that cancers can well be linked to poor sleep habits. It hasn't been definitely proved, but there's a suspicion that they can be. And as Olive's already has mentioned in her talk on good breathing, you need oxygen to kill off cancer cells. We call that oxidation in the body. So these metabolic, we call them metabolic conditions of the body, also of course affect the brain, because we're one system, body and mind. And I think Dr. Martin Benfield has mentioned obstructive sleep apnea. And as I said, I discovered that I had this some years ago, and 80% is often undiagnosed. And this is when your oxygen levels fall in the night, which has consequences, and then you wake up suddenly not being able to breathe. You wake up gasping, and there is a link to many conditions if you have that. And so it's important that it's picked up, because it's all about the body receiving good quantities of oxygen. We talked about obesity affecting sleep. Alcohol I haven't mentioned, but I'm afraid it disrupts sleep in a bigger way, probably more than caffeine.
It's quite interesting, alcohol, isn't it? Because the some of the stuff I was looking at said alcohol you may think is good for getting you to sleep, but actually it disrupts your sleep cycle during sleep.
Yeah.
So it's not such a good plan.
No, it's a bit like sleeping tablets. It's a drug-induced sleep, yeah. And it's harmful in the long run.
Not doing all the good stuff.
No. And the other thing I only realized recently, that if your blood sugar can drop in the night, and that will wake you up. Now, this generally is a problem for people who may be diabetic, and particularly for people who might be on insulin. But it may well be a factor in some people if they tend to overeat late at night, have a big meal, lots of carbohydrate, lots of sugar. That suddenly gives a surge of sugar. The insulin is suddenly released by the pancreas gland to bring the sugar down to proper levels, and they sometimes can overshoot. So suddenly you get this blood sugar going high and then blood sugar going low, too low, and then you might wake up. So it's another reason for disturbed sleep. And if your blood sugar drops, you tend to feel frightened, or you may have bad dreams. It's what we call the sympathetic system of the body, the fear, flight and fright response system.
So it's really trying to frighten you into waking up and doing something about it almost.
Yes, that's right. So it's an emergency button has been pressed.
Yeah.
The brain wants to keep alive.
Exactly.
So we're going on to psychological effects.
Yeah,
So I mentioned stress, chronic stress. You know, it's different from cutting your finger and then suddenly you've got to do something about it. Chronic stress is where you're working all hours, you've got deadlines, you're not sleeping well, you've got everything going wrong, you're not relaxing enough, you're not taking time out. All this has a chronic effect on the sympathetic nervous system. It wrongly sets it, and that affects the brain, the adrenal gland. The adrenal glands sit on top of the kidney. They release not just adrenaline, but also cortisol. Cortisol is like the stress hormone. And you can have too much cortisol. If you have cortisol too much, a chronic, if you like, amount of it, that is, again, is bad. You're more likely to have obesity, diabetes, etc. And then we talked about facts, sleep deprivation. You can get more anxious, you can get more depressed, you can get paranoia. We talked about the memory issues. Olive will go into more detail about educational issues, a very big problem there on children and teenagers. And the other thing that can affect all adults and all ages is reduced cognition causes reduced performance in your job, in your exams, in your tasks. You might make bad decisions. This is no accident why pilots and other key workers have a restricted hours that they can work, because they're trying to protect their sleep pattern. This explains why shift workers are particularly vulnerable to these bad decisions. And of course you have more accidents. Now, something which Matthew Walker talks about, it's been suggested that at least 20% of all car accidents and injuries are associated with sleep deprivation or loss. So it's a big problem in society, and society is not really dealing with this in a serious way.
No, because people are being asked to work all hours. And Matthew talks about micro sleeps, which is just a few seconds. And one of the statistics he gave, which really shocked me, was that if you're drunk driving, your reactions tend to be slow. If you're doing a micro sleep, you have no reactions during the micro sleep. Yeah. And so if you're trying to avoid another car, you might just be slow if you're drunk, but that is bad enough. But actually doing nothing to avoid another car is just appalling. And there has been statistics produced about the amount of road accidents, which is pretty scary.
Yes. I mean, as we move towards robotic cars, you're really getting cars that will switch off if they think your eye movements suggest you're getting sleepy. So maybe that will be a good thing.
Maybe they will. So what's the difference between sleep opportunity and the sleep need?
Well, this is something I've only, again, recently realized from Matthew Walker. I mean, studies have suggested we need somewhere between 7 and 8.5 hours of sleep opportunity. This is where you put yourself in a good position to sleep, which is generally in bed. Other talkers will talk about sleep hygiene and having good surroundings in order to engender this natural sleep rhythm. So I won't go into that detail. But so the sleep opportunity should be at least 7 to 8.5 hours. You actually may only be asleep 6.5 to 7, where you're actually in this deep REM sleep and so on. But you need to give yourself an opportunity to sleep more than that, to get the good quality of sleep.
Excellent. And Is there any difference between the need for sleep and the optimum sleep?
I suppose it correlates with what I've just said. We think we can get by with less sleep, and of course a lot of our employers think we can. But actually optimal sleep is what we define as optimal for your health of your brain and your body, and where you're performing your best and you're not making just poor decisions due to inefficient or lack of quality of sleep. And I think something you've already or going to mention, the other revelation from Matthew's book was that in the medieval times, before the modern light bulb, when they had candles and you would go to sleep at sunset and wake up at sunrise, they naturally had in the middle of the sleep, it used to be called the bewitching hour, but where you would actually wake up, and maybe the modern equivalent is you'd make a cup of tea, you'd walk around a bit, and some people would have, you know, amazing ideas in the middle of the night, and then they'd go back to sleep again. Which that doesn't happen now.
Excellent. Well, thank you ever so much for that talk today. It's really interesting. It's really interesting how we're all learning so much on parallel streams, and they all cross-match together. And so thank you very much for coming today. And I hope the listeners will carry on and listen to some of the other talks. We've got, I think, 10 talks in all going on today. So
and I'm doing one later on, particularly on cognitive decline and
you sleep. Are exactly, and so we will look forward to that one.
Okay.
And is there anything you'd like to say as the last few words on this one?
No, it's just that this is correctable. This is something we can all correct and do and practice and learn.
And if you take Michael and I as examples, we've both been learning this for the last few years, and we have corrected to a large extent our sleep patterns. Yeah. And so you need patience to improve matters, because it's a habit. Yes. And so you need patience to do it, but it's definitely correctable.
Absolutely. Yes. Well, thank you, Olive.
Thank you very much. Speak to you soon. Bye.
Bye.